I was severely depressed. Over a period of 3 years, it continued to get worse. I had trouble with dealing with everyday life, and I went to several different doctors. The first doctor prescribed a antidepressant for me, which made me sick. We tried other things. I had stomach problems with them, with that one. And then I went on to another doctor, tried a couple different antidepressants. Nothing seemed to work really well. I had a severe allergic reaction, kept changing. My life was spiraling. I couldn't get out of bed in the morning. I had trouble working. My family really was very poorly impacted by the whole problem of my depression, and it was very difficult for me.
During that time, it was probably the darkest time of my life. I was sad and miserable all the time and very teary. My relationships suffered with my family and my friends. For me, at that time, I felt like I had a veil over my face and a lead weight on my body. To wake up in the morning was so difficult. And I felt like sleeping a lot, and I didn't have ambition to do anything. I didn't care about myself.
One day I was working with a client, and we were talking about his depression, and I was telling him a little bit about how I suffered from the same thing. And he told me that he had heard about a study that was being performed at the University of Pennsylvania. And I told him that I would like more information, so he gave me the phone number. And I was very excited to hear about it.
Transcranial magnetic stimulation, or TMS, involves the application of magnetic field pulses to non-invasively stimulate the brain. When used as a treatment for major depression, the TMS coil is placed over the left prefrontal cortex, a region of the brain involved in mood regulation, and repeatedly energized. Each time the coil is energized, a magnetic field pulse lasting 200 microseconds enters the cortex and briefly induces an electrical current to flow. Neuronetics has developed the NeuroStar TMS therapy system as a therapy for major depression. The NeuroStar system consists of power electronics, a touchscreen control panel, an electromagnetic coil, a single-use treatment link that is positioned between the coil and the patient's scalp, and a treatment chair with integrated head support. The NeuroStar TMS system is prescribed for use by a trained psychiatrist. A typical acute course of therapy with the NeuroStar system involves 20 to 30 outpatient treatment sessions and spans 4 to 6 weeks. Each session includes the delivery of 3,000 pulses and requires 37 minutes to complete. The patient is awake and alert during the procedure. No anesthesia or sedation is required. Upon completion of the session, the patient can immediately resume normal activities. To begin use of the NeuroStar TMS system, treatment location and treatment level are determined by locating the patient's motor cortex and defining the motor threshold. The motor cortex is located by energizing the coil with single pulses as the coil is moved over the motor cortex region. The coil is positioned over the area that produces a visually identifiable movement of the right thumb when stimulated. Motor threshold is the minimum stimulator setting required to activate the region of the motor cortex that controls the right thumb. Treatment power is then based on the observed motor threshold. The location of treatment is also determined relative to the motor cortex. To begin treatment, the coil is moved 5 centimeters anterior from the motor threshold location along a parasagittal line. This positions the coil over the left prefrontal cortex. The treatment can then be started. The NeuroStar TMS system delivers a sequence of 3,000 pulses during a treatment session. The system presents a summary of the completed session for the operator's review. The patient is awake and alert and can immediately return to work or other activities upon completion of the procedure. NeuroStar TMS therapy was evaluated in clinical trials for efficacy, safety, and tolerability in the acute treatment of major depression. These studies were conducted in patients who had not received adequate benefit from 1 to 4 prior antidepressant treatments. An analysis for predictors of response demonstrated that patients with the best response to NeuroStar TMS therapy were those who failed to achieve satisfactory improvement from one antidepressant treatment at or above the minimal effective dose and duration in the current episode. This clinical study population was comprised of 164 patients with unipolar, non-psychotic major depressive disorder. 97% of these patients had previous depression episodes. Patients in the study had an extensive treatment history without a satisfactory improvement. They had received a median of 4 total prior antidepressant treatment attempts in the current episode, one of which achieved treatment adequacy at or above the minimal effective dose and duration. Additionally, 48% of these patients were unemployed due to their depression. 35% had a comorbid anxiety disorder, and all had moderate to severe depressive symptoms. Acute efficacy in this patient population was evaluated in a randomized sham-controlled trial. This study was blinded to the treater, rater, and patient. NeuroStar TMS therapy was used as monotherapy over a 4 to 6 week period. NeuroStar TMS therapy produced statistically significant change from baseline improvements in depression symptoms as measured by both the MADRS and HAM-D. On the primary outcome measure, change from baseline at 4 weeks on the MADRS, patients treated with NeuroStar TMS therapy achieved statistically significant improvement in symptoms with a p-value of 0.0006. NeuroStar TMS therapy also produced a significant improvement in depressed mood, the core feature of depression, as evidenced by item 1 on both the MADRS and HAM-D. NeuroStar also demonstrated significant improvements on the core depression, anxiety somatization, and psychomotor retardation factors of the HAM-D. The acute efficacy of NeuroStar TMS therapy was also evaluated in an open-label study which more closely resembles real-world clinical practice. In the open-label study, NeuroStar TMS was administered to 43 patients who had previously been treated with sham. These patients were administered TMS as a monotherapy for a 6-week period. A significant portion of NeuroStar-treated patients in the open-label trial achieved response criteria. The response rate, defined as a 50% improvement in symptoms on the HAM-D24, was 54% at the end of 6 weeks. A significant portion of patients also achieved criteria for remission, defined as a HAM-D24 score of less than 11. The remission rate at the end of 6 weeks was 33%. In an analysis of effect sizes from controlled trials, NeuroStar TMS therapy was compared to a meta-analysis of antidepressant medication clinical trials. NeuroStar TMS therapy produced an effect size of 0.52 compared to 0.31 for antidepressant medications. Values for effect size are expressed as Hedges G. The NeuroStar TMS therapy open-label remission rate compares favorably to the open-label results achieved in STAR-D Level 2. The patient populations for both STAR-D Level 2 and NeuroStar represent those who failed to achieve satisfactory improvement from one antidepressant treatment at or above the minimal effective dose and duration in the current episode. Throughout the NeuroStar studies, more than 10,000 active TMS treatments were safely performed, providing the largest safety database of TMS treatments. There were no seizures and no systemic side effects such as weight gain, sexual dysfunction, sedation, nausea, and dry mouth. There were also no adverse effects on cognition. The most common adverse events were headache and scalp discomfort, with a less than 5% discontinuation rate due to adverse events.
By the end of the treatment, once the treatment was pretty well finished, things were better than I could have imagined. After that 6 weeks, I was so excited that my life was starting to resume and could actually get better, and that I had more to look forward to and better things to look forward to. It was just very exciting for me.
Before, when I was going through depression, I felt hopeless. And since TMS, My perspective of life has been so positive that I know there's hope for anything, especially for people that are depressed.
For more information on NeuroStar TMS therapy, please speak to a Neuronetics representative or visit www.neurostartms.com. The NeuroStar TMS therapy system is an investigational device and is limited by federal law to investigational use.